My name is Professor John Deanfield, and I am the NICOR Director. It's my pleasure to welcome you to this annual report webinar, which is the first time we have undertaken this sort of activity to accompany our annual release. And thank you for making the time to attend. Now, the one thing that we have learnt in the COVID pandemic is the importance of big data in healthcare to drive analytics, but also to drive quality improvement and hopefully improved outcomes. Actually, the cardiovascular community has been working on big data very effectively for 10 years or so. And we have incorporated all of our efforts into an organization, a single organization, NICOR, which was set up to ensure that the data we collect was analyzed to produce the maximum outcome in terms of quality improvement and quality assurance. Many of you will be familiar with the activities of NICOR, but I thought I would give you a brief overview of this organization. NICOR is the largest electronic health record data set in the world, and it is centrally funded by the NHS. Very importantly, it is independent and institutionally agnostic. It is accessible to all and captures data longitudinally and continuously and provides expert medical oversight. Now, the center of the NICOR program is the NCAP activities, the National Clinical Audit Program, which involves 6 large registries in a single organization: MINAP, the BSIS registry, cardiac surgery, congenital heart rhythm, and heart failure. And common to all of those registries is a core activity of incorporating and collecting data with central analytics to provide novel insights into the care of patients to improve their management and their outcomes. So there are multiple stakeholders for the NICOR program: healthcare professionals, commissioners, our politicians who drive the healthcare agenda, charities, regulators, and industry are all involved in a two-way use of these data. But most importantly, the public and the patients are at the heart of our activities with the aim of improving outcomes. Every year, we release an annual aggregate report. We also release 6 specialized domain reports, and very importantly, a patient-facing report is also produced. Now, our session today will be in 3 parts. The first part will highlight the annual reports, both the aggregate data and the individual reports. My colleague Mark de Belder will present the highlights of the annual aggregate report, and the domain leads will talk about their individual reports from their domains. In the second session, we will look at new opportunities both for data analytics and presentations, and also look at the future of NICOR in terms of its role in the national data agenda. Now, your input is extremely important in this session, so we have programmed in an extended interactive Q&A session so that you'll be able to ask us questions about the content and of the various reports and also our strategy going forward. Now, even though we have a long session, we may not be able to cover all of your questions, and you will be able to ask us questions which we will then handle if we can't deal with them today and post the responses on the NICOR website. You can ask questions through the portal, the webinar portal, and you can post these in the questionnaire section on the right of your screen. So without any further ado, it's my great pleasure to introduce my colleague Mark de Belder, who has been very important in pulling together the various audits that were set up by specialist societies into one organization, and he will be talking about the aggregate report and the highlights from 2021. Thank you very much, Mark.